Then, of course, these are the things which we know very well by now, that people with comorbidities, particularly uncontrolled hypertension, uncontrolled diabetes, renal disease, and obesity. You see, first two are very important in our setting. That is uncontrolled hypertension and uncontrolled diabetes, because all overall health services, large number proportion of our people do not have access to good health services. Poor people, lower middle class people, even middle class people, and these two conditions like hypertension, high blood pressure, and diabetes, these are asymptomatic. There is no symptoms in the early stages. So 50% of blood pressure, the person who is having the blood pressure is not aware of that he or she is having the blood pressure. Similarly, uncontrolled diabetes. So until unless you go for it, is found accidentally, particularly in the middle age, 35 to 50 years age bracket. And unfortunately, we have got a handicap in Indian and Asian population, ethnic, due to ethnic, genetic, certain predisposition. We get diabetes, we get hypertension, we get heart disease 1 or 2 decades earlier than a Caucasian, than the Caucasians, because of such central obesity and genetic factors. And that falls in the 35 to 50 years, 40 to 50 years, we have got number of people who are not aware of the diabetes. And uncontrolled diabetes, uncontrolled hypertension, the COVID mortality has been shown to be more. And that's why many times you may hear anecdotal that this person did not have comorbidities. Actually, these comorbidities many times go undetected, and that's how these figures can be misleading now. So therefore, when we are thinking of a pandemic or a communicable disease control, we have to think of non-communicable disease control also. Because if we have good control of hypertension, good control of diabetes, subsequent pandemics also, they should not become vulnerable. In the American continent also, in the USA also, in developed countries also, the blacks and marginalized people have had higher mortality from COVID than the Caucasians, because the blacks and the marginalized people did not have access to health services, inequitable access to health services. Their hypertension was not controlled, their diabetes was not controlled. Therefore, mortality was higher in the blacks and Caucasians.